The following segment is sponsored by Northwest Honda Dealers.
Well, anyone who has depression or knows someone who has it knows it can be debilitating. The CDC says about 1 in every 6 adults will have it at some point in their lives. That equals about 16 million American adults every year. And there are dozens of depression and anxiety medications out there on the market. But what do you do if that's not right for you? In tonight's Kind is Better, a look at a relatively new treatment that you may never have heard of, but it claims to change people's lives. Kaylee King Savage has lived with depression most of her adult life.
Like most people, I've tried it all. I think at last count, in the last 20 years, I've been on 22 different medications, trying anything to have some lasting relief from the depression, but meds are a crapshoot.
When she heard about TMS, transcranial magnetic stimulation, she knew she had to give it a shot.
When you say you're going to have this thing put on your head and then it's going to stimulate your brain, it conjures up images of, archaic, terrible things that were done to people.
The therapy lasts about 20 minutes while the patient is seated in a reclining chair, and the machine targets areas of the brain.
We mapped her motor cortex to 10 and 16, so about here. And then when we treat her for depression, we move the helmet forward down to the 3, so the area of treatment is further down towards here.
Medical director and psychiatrist Dr. Allison Hadley has worked with TMS for about 5 years in addition to prescribing antidepressants.
This is just another tool in the toolbox to help people get better from their depression.
Oftentimes, patients turn to this different approach after exhausting traditional methods.
Patients that have tried around 4 medications and haven't had a remission of their symptoms, and have also tried some types of psychotherapies and have not had remission of their symptoms, this would be considered the next step in their treatment of something to try that's not based on medications or psychotherapy.
Are you feeling ready?
Yep.
All right, here we go. 3, 2, 1.
Dr. Hadley says the numbers are encouraging. 70% of patients see improvement in symptoms, and 50% report full remission from depression. Kaylee says she's a perfect example. TMS worked for her. TMS was FDA approved in 2008. Most insurance will typically pay for part of the treatment after the patient has tried other therapies. There's another alternative therapy. It's become quite popular. Float therapy. For an hour, the client lies naked in a sound and light-proof tank filled with warm salt water. The goal is to calm your mind and feel nothing.
It's like floating in space, really. You don't feel anything against your skin. You're sort of free from gravity, so you don't feel any pressure points or anything like that.
So many who can withstand that hour of complete silence and darkness, they emerge from the pod with a deep sense of calm, lower stress levels, and feeling refreshed like they just woke up from a nap.
Very, very strong evidence that it can be used therapeutically for anxiety, for instance. Possibly depression, post-traumatic stress disorder.
Many people feel so relaxed they fall asleep in the pod. Once your hour is up, music will start playing for you so you know your treatment is complete. The National Lifeline can help you get on the road to recovery right now, whether you're having an emergency or not. You can call them at 1-800-273-TALK or text HOME to 741-741. You can also get information about surviving depression at suicidepreventionlifeline.org.